Researchers at the University of Florida are out with a new eye-opening model predicting how many COVID cases the Omicron variant could bring this winter.
And CBS 12 News reporter Danielle Daraj, she continues our team coverage on why experts think the oncoming wave could infect even more people than last summer's record-breaking surge. Danielle.
Well, testing sites like this one here at Gaines Park could get much busier heading into the winter when cases are expected to sharply increase starting next month.
You know, it's going to be a hard winter with a lot of cases, a lot of illness.
Dr. Ira Longini is one of the researchers at the University of Florida who worked on this most recent COVID model. It projects Florida's next wave of infections fueled by the highly contagious Omicron variant. The model is predicting an even higher wave than the summer surge from the Delta variant, peaking in February with at least 30,000 new cases a day. Based on the outbreaks in South Africa and in the UK, the Gainesville team expects Omicron will hit hard because it's about twice as infectious as Delta and has shown it can infect people despite prior infections or vaccination. But there is a silver lining.
The probability of severe disease and death is less for this virus.
This is UF's model for predicted COVID deaths. For the first time, the number of cases and the number of fatalities are uncoupling. That is, they no longer follow the same curve because Omicron appears to be a milder form of the disease. And being vaccinated and boosted still protects against hospitalization and death. The new data suggests Florida will peak at about 100 deaths a day early next year, much lower than the 400 a day we saw during the Delta surge this summer.
The name of the game is to get vaccinated if you're not vaccinated as quickly as possible. Because if you're unvaccinated and you haven't been previously infected, you're quite high risk of not only getting Omicron, but possibly severe disease.
Dr. Longini tells CBS 12 News that this next stage of the pandemic might cause us to look at COVID a little bit differently. It's no longer a question, he says, of if you might get COVID-19, but rather a question of how severe your infection could be. And he reminds us that masks, social distancing, and vaccinations remain effective tools in the fight against the virus.
COVID cases spiking around the globe, including here at home. The number of positivity cases is multiplying by the day, and lines at testing centers are wrapping around parking lots in some areas.
Tonight, we have live team coverage on Florida's COVID cases tripling and what to expect as we approach the holidays and large gatherings.
And we begin with CBS 12 News reporter Andrew Lofholm. He is outside the South County Civic Center in Delray Beach. And Andrew, how is it looking out there?
It's been a long line here all day. So that's Jog Road right there. You can see the cars begin lining up there, wraps around the block, and then it wraps all the way around here, the outer loop, and then this inner loop right here. Eventually they have to get all the way over here to this. Said it takes up to 3 hours. Not only is Christmas coming up, but people are getting ready to spend time with their families or getting ready to travel. Testers crawling through the drive-through line. This is Florida Atlantic University's site. This is in Delray, where we met Hugo Vasquez. He's flying to Canada for Christmas.
Canada, they request like the COVID test like at least 72 hours before go, and my flight is the 23rd. The problem, I'm going to spend it here 3 hours.
As the Christmas holiday is closing in Florida, it seems, is at the beginning of another COVID wave. These are the weekly COVID numbers in Florida. They come out every Friday. So you can see here, latest numbers, cases jumped nearly 3 times compared to the week before. But this number down here, the positivity rate, that's the number that public health officials are really focused on. How many people that have taken those COVID tests actually come back positive? Well, public health officials like that benchmark to be under 5%. You can see here for weeks now, it's been under 3%, but the latest number right here, 5.4%. Dr. Clifford Almeida is an infectious disease specialist at the JFK Medical Center. What we're seeing with the rise in cases and the positivity rate, what would you tell somebody as they get closer to the Christmas holiday?
I'll tell them to be mindful. Be mindful of your surroundings. Try to, if you can move your party outside, move your party outside. If you can get folks tested with a rapid test before they come to your party, have them tested.
While cases are up, for now, the patient load at hospitals has remained steady. Hospital-wise, have you guys been busier with COVID patients than you have been?
No, we have not necessarily seen more admissions yet related to this bump. We don't know whether we're going to see a greater number of admissions.
The Omicron variant is now the dominant strain of coronavirus in the nation. Experts say it's moving much faster than Delta, spreading quickly in states like New York and already taking hold in Florida. The Sunshine State is fighting back with vaccines and especially new COVID treatments. But CBS 12's Jay O'Brien reports that even those resources could soon be strained. He joins us live in the studio tonight, Jay.
Yeah, Liz, here's what's concerning the doctors and the epidemiologists, the disease tracking experts that we spoke with. Just this week alone, the last week we had data for the three largest counties in Florida, Miami-Dade, Broward, and Palm Beach. They saw a huge skyrocketing in their case numbers. Miami-Dade saw a 322% increase in COVID cases. That's an increase. Broward saw a 213% increase in their COVID cases. Palm Beach County saw a 160% increase. So they were going from few COVID cases to a lot of COVID cases. And these percentages, what they show you is the rapid increase that this COVID strain has had in the Sunshine State and the strains it may place on the healthcare system that we've put in place to treat people who get the virus.
The line for monoclonal antibodies extending beyond this clinic's doors in West Palm Beach today. As cases climb, the treatment seen as a weapon in the war against the Omicron variant. Some brands of the drug proven to work against the new COVID strain, but not all. The treatment given through an IV or a series of shots.
One here, one here.
Parker Weisner, newly diagnosed with the Omicron variant, got the injection today.
But I feel at least like I'm getting treatment.
Antibody treatment's a priority for Governor DeSantis, who opened this clinic and more than a dozen others across the state, a first-of-its-kind system. But supplies are still limited, and Dr. Leslie Diaz, an infectious disease specialist in Palm Beach County, explains the drug doesn't work as well if you wait.
These tools that we do have to be taken early.
Meanwhile, Diaz and other health experts say vaccination, including the third booster shot, is still the best line of defense against the virus. This weekend, fans briefly booed President Trump after revealing he got the third shot.
Did you get the booster?
Yes.
I got it too. Okay, so...
Don't.
But Governor DeSantis declining to say if he's been boosted in an interview yesterday.
Have you gotten the booster?
So I've done whatever I did, the normal shot, and that at the end of the day is people's individual decisions about what they want to do.
Now, there's another COVID treatment the doctors tell us may help them in this fight. Drug companies Pfizer and Merck are still waiting on FDA authorization for their pills, which would reduce the risk of becoming severely ill if you catch COVID. Those could be available as early as next month.